Well, well, Dr. Sicko, before you go on and talk about some of the work you're doing in comorbidities, just on this issue about how you've changed the way you practiced because of the pandemic, do you think it's a better practice style than what you were doing before? What's going to happen when everybody's vaccinated and back to normal? Do you want to keep your telehealth practice this way, or do you want to go back to seeing your veterans?
As wonderful and fantastic as it is to sort of see people face to face, telehealth is here to stay
Mm,
across the board. And so my experience, and we've done surveys and qualitative work to this regard, veterans are highly satisfied with
mm,
telehealth appointments. Yep, absolutely. And Dr. Shulkin, before answering that, wanted to maybe just build on something that Dr. Hoffman had said in terms of, how are we able to get neuromodulation or neuromodulatory devices into the hands of veterans, especially
mhm.
during a pandemic. So some of the things that we've done is capitalized on the use of telehealth. So that way, I see veterans all over the country for a headache, and specifically in New England, but also all over the country. So I don't need to. So they don't need to come down and see me anymore physically in West Haven. I could see them over the phone, talk to them. We could come up with a treatment plan. And then once they get their device, we could do another telehealth visit to make sure that they're using it correctly. So it's been really fantastic because nowadays we don't even have to sort of physically see someone in clinic to help make the best diagnosis, provide treatment, as well as provide ongoing instruction about neuromodulation. So as wonderful and fantastic as it is to sort of see people face to face, telehealth is here to stay
Mm.
across the board. And so my experience, and we've done surveys and qualitative work to this regard, veterans are highly satisfied with
Mm.
telehealth appointments. They don't feel as if they're getting lower quality care. And really, especially in considering the veteran population, when they may live hundreds of miles away from the VA that they prefer to get their care at. So to give some kind of example, I'll see veterans from Maine.
Sure.
It's a 10-hour trip one way to see me. So I've had many veterans tell me, Dr. Sicko, I love you. You're fantastic. I'm not going to see you in person ever again. And I'm okay with that. I'm totally okay with that. If as long as they're satisfied, they're getting good quality care, and I don't have a convincing reason to see them in person. So I think it's so in parallel with the fact that
Yeah.
we have a lot of great therapeutic modalities to treat patients. We have a lot of with telehealth. We have a really wonderful opportunity to improve access and maintain access.
No, listen, I agree with you. I never used telehealth before I got to the VA, and I used to see patients from my office right across from the White House. My patients were in Grants Pass, Oregon, because that was a little rural clinic that lost their primary care doctor. I said,